reversal agent to warfarin. So know that vitamin K is the reversal agent to warfarin. However, when vitamin K is given, the patient will be resistant to warfarin to up to a week. So if we want to get them back to being anticoagulated, we can't give that Coumadin, we can't give that warfarin for up to 7 days. This is helpful for me to remember. I learned this in school, so I'm like, which one's PTT and which one's INR? So you can hold out your hands. Heparin, Heparin, is 7 letters, and PT is 3 letters. So Heparin, PTT. And then Coumadin, which I know is the brand name, but Coumadin is 8 letters and PT is 2. So Coumadin, PT. So heparin, we monitor PTT, and Coumadin, we monitor PTINR. The next class within this chapter is our antiplatelet drugs. Platelets, we talked about platelets. Platelets are a big deal in bleeding. Platelets, when platelets aggregate, that word up at the top, platelet aggregation, the platelets become sticky. They become sticky and they clump together. If we give an antiplatelet drug, this is going to work to prevent platelet adhesion, to prevent the platelet aggregation. When an area on our blood vessel, really anywhere, is damaged, the platelets will go there as helper cells. So think about this when we have heart problems, right? We have cardiac artery damage. So that damaged area, the platelets are going to go to and start to adhere. When we're giving an antiplatelet drug, it's going to stop that adhesion. So if I say we give an antiplatelet drug in patients who are at risk of a heart attack, where do you think we're concerned about that clotting? In the coronary artery, right? So who do we give aspirin to? We give aspirin to patients with cardiac risk factors, typically an 81 milligram aspirin. So we have aspirin, clopidogrel, which is Plavix, and then eptifibatide, which is Integrilin. Our adverse effects are bleeding, right? So aspirin is going to decrease the platelet aggregation, which is the sticky clumping platelets. We're going to give this for all sorts of stuff, right? We can give aspirin as an antiplatelet to prevent the sticky platelets from clotting, but also pain, fever. You do not give aspirin to children. So just don't do it. So something called Reye's syndrome can occur. So if a kid has varicella, influenza A, or B, so they have varicella or influenza A or B in their body, so they have a viral infection, and we give them aspirin, any salicylate, but aspirin. They're gonna feel better, and then a few days after recovery, their liver is gonna get big, and then they're going to get swelling on their brain, okay? So we can give Tylenol instead. Do not give aspirin to children due to Reye's syndrome, which results in liver damage and brain swelling. Clopidogrel or Plavix, again, it's that antiplatelet drug, prevents the platelet aggregation. It works by altering the platelet membrane so it can no longer receive signals to aggregate and form clot. But we know that it is preventing the platelets from becoming sticky. And then Integrilin here is going to work in a different way, but it's still an antiplatelet drug. It's going to work to prevent the platelets from becoming sticky. So we talked about our anticoagulant drugs. We talked about our antiplatelet drugs. Now we're talking about our thrombolytic drugs. So remember when I said, do not say blood thinner? Because it doesn't thin our blood. Can heparin break down blood clots? No. Can warfarin break down blood clots? No. Can Plavix? No. If you are actively having a stroke and we give you those things, it's not going to break down the blood clot. So the only drug that is colloquially a blood thinner is going to be our thrombolytic drugs. So we talked about lytic, which means to lyse. So thrombus is the clot. Lytic is to lyse or break down. So these are the only drugs that are going to break down the existing clots. Our concern, though, with our adverse effects is that these work too well. Anywhere within your body that has a clot, this is going to break down. So if I tried to poke you 4 times with an IV and I missed, and I give you a thrombolytic drug, it's going to help with your brain, but you may also have bleeding at the IV sites. Anywhere, if you have a scar, a scrape, anywhere that you had a blood clot that was protecting you, this is going to break down. So I did not write it in here. Our thrombolytic drugs are TPA. So your book will have that, but TPA, this is going to be our clot buster drug. We call it Activase. But if somebody comes in and they're actively having a stroke based on symptoms, because we can't really image your brain, based on symptoms, and you meet certain criteria, you will get TPA, which is what we call the clot buster, if you've heard of that. That is what we're going to give you if you're actively having a stroke. We give in other certain circumstances, but this is really, because these drugs are so risky, we want to give them for big reasons. So this next one is an antifibrolytic drug. So the antifibrolytic drug, so let's talk about this. So fibrinolysis is breaking down fibrin. So breaking down fibrin results in what? Bleeding. But if we reverse that process and we have an antifibrinolytic drug, we are actually going to prevent bleeding. So that's kind of wild. So we've got some adverse effects here. Aminocoporic acid is one that we may give. So antifibrinolytic is going to prevent bleeding. So we would give this drug to prevent and control excessive bleeding that results from surgery or an overactive fibrinolytic system. So if we're concerned about bleeding too much, this would be an indication for an antifibrinolytic. Aminocoporic acid is an antifibrinolytic. And then we have desmopressin or DDAVP. And we can actually give this for diabetes insipidus. So that's pretty crazy. We talked about this. We've yet to talk about it. We will talk about it. Desmopressin or DDAVP is a drug that we can use for multiple things, but we can also use this for hemophilia. Hemophilia, we remember, we're bleeding too much, so this drug we would give to bleed less. Transischemic acid is another one. And again, guys, I would just know what an antifibrinolytic is and what the drug names are that are antifibrinolytics. But we can use transischemic acid prior to surgery to help prevent that excessive bleeding process. All right, that's been chapter 26. Thank you.